Thank you for coming out. Today is a beautiful day. Actually, right now it's not very sunny, but it was sunny a little while ago. The sun's just going down right now. So you may be asking yourself, this is a guy walking his dog here. I don't want to compete with him, but maybe you'll hear his voice. So I don't want to compete with a guy and his dog. So seriously, you might be wondering, why am I out here all sweaty like this? Well, it's good to exercise. So a lot of people are concerned about cholesterol levels. A good way to get your cholesterol levels balanced is to do healthy exercise. Some people, though, who have a heart condition, they have, as you know, an imbalance very oftentimes in their cholesterol. So it's not uncommon for people who have trouble with their heart to be exercising too much and to be overly active people who are concentrating on just doing a million different things. The dog's going to come up to me and play with me here, maybe. And so when that happens, it's a cute dog. You'd love him. And let's take a look at the dog here. You see the doggy? There's the doggy there. Okay. We got a little video of your dog. Okay, there's another picture of the dog. Look at that cute dog. So if you hang out with animals, animals can lower your cholesterol. If you hang out with good quality friends and family, as long as you're not arguing too much, that can lower your cholesterol. And a person who has a heart condition, their cholesterol levels are very oftentimes imbalanced. So it's not really so black and white, though, as you may assume. I do recommend lifestyle changes. Look at me. I'm not shaven, if you can see on this quality video. I'm sweaty, and I don't dress like this at the office. I just dress like this when I go to exercise, of course. So the question is, or not the question, but the assumption could be made that what I'm doing is healthy, right? But that's not necessarily the case. What I did today, which was to go running for 3 or 4 miles, is healthy for me. But that's not necessarily a healthy thing for everyone. Everybody has lifestyle changes that should be specific just to them. In our office, we find out exactly what lifestyle change for you would be best for you. People with a heart condition, they're doing too many things too fast in their life for years and years and years, and then at the end of many years of stress, they ended up developing a heart condition. So there's many causes of a heart condition, but that's the overall idea. A father who raises a family, and he has a great family, and he's rather successful. That father, a male, of course, it's not uncommon for them to get heart disease because they just worked so hard to help their family. Or somebody, let's say, who got sick all the time, they ended up with an infection. The infection could irritate certain vessels, like arteries and arterioles and veins and venules, and that ends up, for some people, it could lead to a heart condition. An allergic response carried out for a long time, what's known as an Arthus reaction, can lead to a heart condition. My point is that if you exercise the wrong way when you're too tired, that can be hard on the heart, that can raise cholesterol levels. Whereas if you're not getting enough exercise, that can also be a form of stress to the body, because there's not enough exercise, there's not enough good stress called eustress. Instead, there's distress, disease. So good stress is good, bad stress is bad. This is all research for years and years and years by a Canadian medical doctor named Hans Selye, who's very famous. He wrote a book called The Stresses of Life. So I hope this has been helpful. You want to do exercise that's good for you. I can't say what's good for you for sure. Most people, like from my patient population, almost all of them do great with yoga, for example. Sometimes not after the first couple days after a treatment, because after a treatment they're in a deep healing state. And we want them to stay in the deep healing state and not get themselves stressed, which would then interfere with their healing process. But most of my patients do great with yoga. Most of my patients do great with, some good long walks here and there. Some patients do great with real aggressive physical activity. Just depends on the patient. Everybody's different. Okay, thank you. We'll talk to you soon.